Salt is sodium chloride. Sodium is an element that's needed for good health. You must have a certain balance of sodium and water in your body at all times.
Too much salt or too much sodium can cause that to be out of balance, and it can cause harm to your body. Dietary sodium is measured in milligrams, or what you might see mg.
Excess sodium affects the heart, kidneys, and blood vessels.
Too much salt is bad because it draws extra water into your body, and that makes your heart have to work harder.
This can worsen your congestive heart failure, or CHF.
It can also increase your blood pressure, which can complicate your CHF. So it's definitely something that you need to restrict. Your doctor's recommending that you restrict the amount of sodium you have in your diet each day.
Did you know the average American consumes more than 3,000 milligrams a day of sodium?
It's about 75% of our sodium intake comes from packaged foods and restaurant foods and processed foods.
However, it's suggested that healthy Americans try to eat less than 2,300 milligrams of salt per day, which is equal to 1 teaspoon of salt. With CHF, you're recommended to keep your daily intake of sodium to less than 2,000 milligrams per day. While paying attention to the salt shaker is important, pay attention to food labels because they tell you how much sodium is in food products. Here's a list of the sodium compounds to limit in your diet: salt, monosodium glutamate or MSG, baking soda, baking powder, disodium phosphate, or any compound that has sodium or Na in its name.
You might also see it as sodium bicarbonate, sodium hydroxide. Any of those things indicate that there's extra salt or added salt in that food. Salted snacks need to be limited. A few other foods that need to be limited are fish that's been smoked or pre-breaded, any kind of casserole or frozen food dish that's kind of that ready-to-go packaged food. Other things like ham and sausage. Some other foods that contain salts are canned foods, canned juices, cheeses, buttermilks, lots of seasonings, ketchups, condiments, other things like that you'll have to be careful of.
Reading labels can be somewhat tricky to know which products are the best to choose. Here are a few key words that will help you. Sodium-free, less than 5 milligrams per serving. Very low sodium, less than 35 milligrams per serving. Low sodium, 140 milligrams or less per serving. Reduced sodium, a 75% reduction in sodium from what's usually found in the original form of the product. This is not the same as low salt. And unsalted, no salt added, or without added salt. These are used for foods processed without salt, which may ordinarily have salt, like pretzels or potato chips.
One of the biggest things that people can do to reduce their sodium intake is eat foods that are fresh. They aren't already processed and they have so much more flavor and they don't need a lot of extra added seasonings.
Eat at home as much as possible. You're better able to control the amount of sodium that's added to your foods. Choose fresh lean meats, skinless poultry, fish, egg whites, and tuna canned in water. You may be interested in using a salt substitute, but make sure you check with your doctor to make sure these are appropriate for you.
Whole foods are your best choice. Low sodium broths, salt-free broth, those are some really good choices.
Choose unsalted nuts and low sodium peanut butter. Cook dried peas and beans.
Canned beans, although they are canned with salt, you can reduce the amount of sodium that you eat by rinsing them in a colander with fresh water, and try that several times. And then when you do cook them, make sure you put them in a pot with fresh water.
Try to find foods that are at the peak of the season to provide the best flavor without added ingredients. They also provide the best complement of other nutrients as well.
One thing you can add with those is herbs. Those that have very good flavor without the added salt. Things like chives or dill, basil, lemon verbena. All of those things are very good choices that you can find in your local grocery store.
Lemon, lime, and other citrus juices can add a lot of flavor without the added salt. Spices go a long way in adding flavoring while keeping your sodium in check. Mrs. Dash and other no-salt seasoning can be a convenient way to flavor foods. There are many different varieties available. Remember, you'll get used to eating less salt and your tastes will adjust in about 2 months' time. Limiting sodium is one of the most important lifestyle changes you can make to help maintain a good quality of life with CHF.
Making lifestyle changes, such as cutting salt out of your diet, can really help prevent additional complications with your congestive heart failure and reduce the use of medications.
Go through the items in your fridge and pantry and eliminate foods that should be avoided and replace them with healthier, tasty versions. Make sure that the other people in your household support you in these changes, and you can encourage everyone to get used to eating less salt.
Visiting your doctor's appointments with you can be very good. They can understand why it's so important for you to make the lifestyle changes that you need to, and again, can support you in that. Ask them to go with you to do certain activities and to spend more time outside or exercising and things. That can be a big support to you and to them as well.
Each participant and family members will attend at least 2 classes on nutrition and how it relates to CHF. Ask your doctor about the times and dates for this class and get registered today. We'll see you there. Also, talk to your doctor or dietitian, as members of your family may also be at higher risk for heart disease. It's very important for them to make changes now to lower their risk. Knowledge is power, so learn and live.